Sorry about that earlier Zoom link. I have 4 shows a week and I grabbed the wrong link.
No, not a problem. Yeah,
Yeah.
I've never watched one of your marijuana shows. I'm going to have to do that.
Well, they're on the Facebook. They're easy. They're there, so you can watch
Yep.
them on demand.
Welcome to M Squared Techcast, a live internet radio show offering the latest news and interviews with the people driving business, technology, and politics in Michigan. Now, your hosts, Matt Roush and Mike Brennan.
Hey, it's Matt Roush.
And Mike Brennan.
And we are back with a thankfully post-election version of the M Squared Techcast. The ads on my television aren't yelling at me anymore about how the other guy's a bastard. So, that's a good thing.
Yeah, the poor people in Georgia.
Oh
my
yeah.
God. If we thought we got inundated with political ads, ain't nothing like those people in Georgia are going to get. So.
Oh, yeah. Oh, my goodness. Yeah, everybody's going to be lined up for those 2 Senate races without a doubt.
Yeah, absolutely.
So, but we've got a great show for you today. We're going to start things off with our tech law expert, Enrico Schaefer, or as we sometimes call him here, Enrico Suave. So,
good to see you guys again.
Yeah. Thanks. Where are you today, by the way?
So I'm in the Detroit office today,
very
which
nice.
I
Yeah.
guess for everyone is like home, right? And so yeah, in Detroit these days.
All
Cool.
right.
All right. Because I know you're frequently all over the place with your clients. So
Yeah.
Let me ask you. I imagine your travel schedule has been whacked way back too, right?
Almost completely, Mike. I mean, I haven't been anywhere since late February. So it's been a lockdown situation for me. Courts are doing everything remotely for the most part. So no one's traveling for depositions. Those are all remote. It's the legal system has adjusted fairly well to the remote situation. If you think about it, how much money is spent every year for clients paying for their lawyers to fly all over the place, right? So one of the good things from COVID, that's kind of come to an end.
Before we start on what we're going to talk about, so let's follow up on that. Do you think that this is going to be the new norm for the legal, or is there going to be some sort of hybrid in between?
It'll be hybrid, but the fact that we've been here, right, means that we're going to end up back here a lot more. And this was the rare exception where you would have a court hearing by phone or by Zoom. Now it will become the rule, and judges love it too, by the way.
sure, yeah.
They've got a mute button.
They can have their jammies on under their robes too if they want. So
Exactly.
Of course, I think some of them do anyway. But anyway, you wanted to talk today about your action against Airbnb on behalf of Airbnb hosts.
Sorry.
So let's get an update on that. Where is that lawsuit now?
Yeah, so really exciting things going on, as you know, because I think the last interview I did, we were talking about these arbitrations we were filing against Airbnb under the terms of service by hosts who had their payouts diverted, and in some cases simply just taken by Airbnb, which simply just acted in its own self-interest. Once COVID hit, it wasn't going to survive. So it basically took all the money that was going between hosts and guests and commandeered a bunch of that for itself. In virtually every platform, as you guys know, there's always a arbitration clause, a class action waiver clause. So we've spent a lot of time trying to understand how we can get around that. And the good news is, based on a lot of the responses we got from Airbnb in these arbitrations, these, scores of arbitrations that have been filed, we were able to find a viable legal theory to file the class action, which went in last week. And so it's a massive multi-billion-dollar class action that is now pending in the Northern District of California federal court, and is
that's the tech district, all right?
Yeah, it's been filed by us, and then we basically interviewed a bunch of class action law firms to partner up with, and we found this great firm, the Gibbs Law Group, who's got all the expertise, resources in the world to go toe-to-toe with Airbnb. Bring my pretty face with their resources, and we think we might have a shot.
All right.
Go ahead, Matt.
No, you go ahead, Mike.
So how many clients do you have in your class action suit? Are we talking dozens, hundreds, thousands?
Well, hundreds of thousands, and perhaps, more. It's hard to tell exactly how many US hosts there are, but it's right now the class definition is all US based hosts. We're looking to expand that to be
Wow.
all hosts globally, but right now in this initial filing, it's all US hosts. Now, keep in mind, in a class action, everyone who meets the class definitions automatically included. That's where the hundreds of thousands come from. We've been contacted by hundreds, maybe even, over 1,000 hosts about filing a class action who are now excited about the fact that we've got a court case in play seeking not only to get the money that Airbnb diverted from the payouts, but also to change the terms of service to something that is much more fair and far less unconscionable. And that's a big thing because these platforms, since they draft the terms, they think they could take everything and your firstborn child. What choice do you have? It's take it or leave it, right? And then when you get into a dispute, which they say they're committed to resolving these efficiently and cheaply and in AAA arbitration, you find out that's not true either, and they're going to fight on every single little thing to the death. And so it needs to change. And a lot of platforms did get the memo years ago. Google, Facebook, all of a sudden they shifted. You might recall the terms used to be they could do whatever they want with your data and they don't have to tell you, right? Now, none of that exists. It's all, you have privacy controls, you get to control, reminders of control, very detailed terms of service, which say exactly what's going on. You got GDPR in the EU, right? So all of this is flipped on its head to be a user-centric terms of service approach in a lot of these platforms. Airbnb never got the memo, right? There's still say, we'll take your first child if we want to, and there's nothing you can do about it. So we're trying to change that for the sharing economy moving forward, just much more fair, reasonable terms of service.
Now, tell me a little bit about how this has worked for the average Airbnb guest. I'm going to tell you a little personal story here and then try to figure out where that money came from that I later used as Airbnb credits.
Right.
My wife and I had planned this epic 2-week driving vacation where we were going to go from Detroit to Toronto to Montreal to the coast of Maine and then come back through Boston and Niagara Falls. Now, the only place we had a regular hotel room anywhere in that trip was Boston. Obviously, we had to cancel it. For one thing, they weren't letting us into Canada.
Yeah.
And Airbnb said, well, we'll either give you half your money back in cash or you can have all of it back in Airbnb credit. And we chose the Airbnb credit because we figured we'd use it all eventually. And indeed, we have used most of it by now. So where did that money come from? It wasn't conjured up out of thin air. So
I'm a host. It came from me. I paid for your Airbnb, and that's the problem. So the travel credits, we call it the travel credit scam, because what it was is Airbnb didn't have enough money to meet its expenses. It got $2 billion from its then investors to shore up the ship, but it also needed more money, and it had all these upcoming payouts to hosts. So they couldn't make those payouts, and so they said, hey, guests, we're going to give you a full refund. But when you got there, what did you find? You found two choices: accept the cancellation policy that you'd agree to with the host, which said you don't get a refund, right? Or take this travel credit, no questions asked, from Airbnb. And of course, most guests did that because those, between the two options, that's the better one. Yeah. The problem with that is Airbnb, by offering that travel credit, simply took the host money and took it for itself. And then it got to hold that money while you waited to use your travel credit, right? So it kept its cash, and it was able to move that money from its payment processing arm into its own account. So it used that money to fund itself out. Now, you used your credits fairly quickly. A lot of guests have until next year, December 2021. So Airbnb gets use of all of my money in the meantime, which it diverted, which it had no interest in, right? You may or may not use your travel credit down the line. And if you don't, Airbnb keeps that money, in which it held as a fiduciary, as an escrow to that transaction. It's just a bridge too far.
Yeah.
So if there's people watching or either now or on demand and want to join into your class action lawsuit, what would they do?
So go to traverselegal.com. Traverse is in Traverse City, right? Traverselegal.com. You'll see a link on the homepage for these Airbnb cases. just get into the system, because then we'll keep you up to date about what's happening. And here's the other big news is, under the new terms of service that Airbnb came out with last week, after we fought them for 6 months on how terrible their terms were, they came out with new terms. We won. Oh no, the new terms say we get 2 of your children and no question asked, right? So those new terms come into effect January 20th of 2021. And what we're telling hosts, if you don't file your arbitration claims on these refunds, on these diverted host payouts by then, Airbnb is going to say you're under the new terms, which are even worse than the old terms. So get your arbitration claims filed. You can contact us. We can help you with that as well.
The other service that I've used to rent vacation homes, I've been using them for 20 years or more, is something called VRBO, which stands for Vacation Rental by Owner.
Yes.
Are those terms any better if you're a host for VRBO,
Yeah.
or are they just as bad?
No. VRBO, Booking.com, these platforms, for the most part, did not interfere with the rental contract between the host and the guest, to which none of them are a party, right? So you should have worked that out with your host. They probably would have given you a travel credit, right? But all the other platforms played by the rules. Airbnb, who was supposed to be going IPO in May, decided they were going to take advantage of this to really level up on their competitors, because when travel started again, the guests who got that full refund travel credit from Airbnb, well, if it's travel credit, you're going back to Airbnb, right? So they were able to engage in all sorts and all levels of self-dealing by interfering with those rental contracts between hosts and guests.
Okay, we got about 3 minutes left. Is there any other hot legal news besides your dog there is getting ready to jump on your couch? But,
yeah, that's Cooper, and it's a dog eat dog world. I think that the other big news out there is that you've got all these amazing tech companies that seem to be thriving in the midst of COVID, right? And we've seen, certainly a lot of the online retailers. We were really worried, as everyone else was, when COVID hit, what was going to happen to our clients. And yes, we have clients that are suffering, but the shocking thing is how many clients we have who are just crushing it. And so that, I think, should be hopeful for all of us, especially with this vaccine news today, right? That the ones that are suffering will be able to come back, and the ones who actually are doing better, they'll be able to build upon that into the future.
Okay.
All right. So you came to us originally as a drone law expert way back in the day.
Mm-hmm.
Is there anything new and interesting regarding drone law these days, or has that all been pretty much settled out by the federal regulations that have been in effect?
So federal regulations are definitely fairly predictable at this point. And so now it's drone service providers who are looking to do more than real estate photography, right? They're looking to deliver things from point A to point B within a hospital system. They're looking to do agricultural spraying. They're looking to do multiple drones from a single controller. And so there's now a path for all of those different types of operations through the FAA regulations. But look, drones did get a bump in COVID just from the idea that we may need things coming and going by drone, which is a much safer alternative. So we did see a bump in that market because even after COVID, I think people understand we need things like drones to help us when situations like this arise. And we weren't quite there yet on the drone side to be able to go ahead and go to market with a lot of this stuff. Hopefully next time, if there is a next time, drones will be a big part of the story.
Okay, cool. This is we got to cut you off here. Why don't you one more time give us the address if folks want to reach out to you for drones or Airbnb or any other tech legal issues they go to where?
TraverseLegal.com. Enrico Schaefer. You can find me online with a search of Enrico Schaefer or Traverse Legal.
Okay.
All right. Thanks very much, Enrico Schaefer of Traverse Legal, today at the Detroit Bureau with the puppy. We'll be back in just a minute with another segment of the M2 Techcast. For right now, it's Matt Roush.
And Mike Brennan.
And you're watching the M2 Techcast at mitechnews.tv and wherever fine podcasts are distributed.
As a Lawrence Technological University graduate,
Thanks,
we're not
Enrico.
only marketable.
See you guys.
I'll get you that MP4 later in the week.
Awesome.
When it comes to graduate salary,
All right. Take care.
LTU is in America's top 100. Be invaluable. Be more. At LTU, possible is everything.
Salaries of Lawrence Tech grads are among the highest of any
There he
university
is.
in America. Plan a campus visit to meet
Pronounce your last
counselors,
name for me.
faculty, and coaches.
Stibbits.
Why wait? Find
Stibbits.
out more at
Stibbits, yep.
ltu.edu.
How you doing?
Good. First time we've met. I've had a long relationship with all your predecessors. So.
And a higher starting salary. In fact, when it comes to earning potential, the Brookings
Yeah, good to meet you.
Institute ranks
Hopefully we'll
LTU,
do it in person
U.S.
sometime.
colleges and universities.
Someday.
Be enriched. Be more.
Yeah,
At
next summer,
LTU,
it's sounding like.
possible is everything.
Salaries of Lawrence Tech grads are
Gotta
among
survive
the
this winter
highest of
first.
any university.
Yeah,
in America.
exactly.
Plan a campus visit to meet with counselors, faculty, and coaches. Why wait? Find out more at ltu.edu.
Hey, it's Matt Roush.
And Mike Brennan.
And we're back with another segment of the M Squared Techcast. We have with us today a first-time guest on the show, but certainly we have interviewed many of your predecessors through the years and always been impressed with how the state runs its IT operation. It's Bram Stiggets. Did I get that right?
Stibbits, Bram Stibbits.
Stibbets. Okay, sorry. Okay, wrong consonant. Listen, why don't we start out with you give us a little bit of your background and sort of your career path and how you came to be in this position.
Yeah, sure. Well, I've been in state government for about 15 years. I actually started out working in the legislature, what seemed like a long time ago, as a policy advisor, and I ended up working the last couple of years there for the speaker from 2008 to 2010. After that, I spent about 5 years in the state treasury department, doing a number of things there, working on, some IT initiatives there, as well as culture issues, things like that. And for about the last 6 years, then I've been at the Department of Technology Management and Budget. And so I was in state government speak, the chief deputy director for, until the last, say 7 months. The chief deputy is kind of the COO for the organization. So DTMB is, I'm here because we're the IT department for the state, and that's about 2/3 of our employees and what we do. But we also run a number of operations for the state, including, facilities, procurement, fleet, things like that. So been there, and in March, early March, the governor appointed me CIO, and about a week later, we tried to send about 30,000 people home to work. So trial by fire, I guess, but I think maybe we'll come back to that a little bit later in the conversation.
Yeah, let's start off with the latest news, though. For the sixth straight time, now I was corrected by Caleb. I thought it was 6 straight years, but it's actually the surveys every other year. So essentially it'd be 12 years. The
Wow.
Center for Digital Government has recognized Michigan with a grade of A, and you're only one of a handful of states. I think Virginia, maybe, and Maryland were in there too, but you guys are at the top of the list.
Yeah, we are, and thank you for giving us some time to talk about this. This is something we're really proud of in Michigan. And for those folks that aren't involved in, let's say, public sector, or aren't familiar with the kind of the state government space in IT, this award, this is the most comprehensive review of state government IT organizations that there is. And so it really means, we believe it means a lot to receive an A grade on this. Like you said, there were only 5 states across the nation that got an A grade this year. Like you said, it's done every other year. And Michigan is only one of only 2 states to have actually gotten an A every time that they've done it, 6 consecutive times. Utah is the other state that's gotten that A 6 times in a row. So this is something that we're really proud of. And, it's, look, you always like to be recognized for the work that you do. But this survey, it's, like I said, it's pretty comprehensive. So it looks at the things that you've done to support state priorities. It looks at what have you done to improve operations? What have you done to help with hard and soft dollar savings benefits? Coming up with innovative ideas, citizen-centric services. How do we collaborate? And the tough thing about the survey is, as much as I can say, the early years, that was work done by not me and a lot of teams before us. So we certainly stand on the shoulders of others. But kind of the cool thing about this is you can't just rest on your laurels. You have to continue to demonstrate that you're making progress. So it's not just, hey, you're still, 99th percentile or whatever. You have to continue to innovate and to try and drive additional benefits from IT for doing this. And so, as we look at it, what we heard, I can tell you some of the reasons that we got the A grade, but before I tell you what the Center for Digital Government said, I'm just going to give you my soapbox here for a minute, since you're putting me on your show, and folks that know me are going to be sick of hearing this, but it comes back to the people. And I think a lot of people that have worked in IT for a long time know, how many times have you rolled out a product that could have been a perfect IT product that did exactly what it was supposed to do, and it maybe not failed, maybe it failed, maybe it didn't do as well because of the people angle. And so we spend a lot of time and effort in DTMB. Like I say, we're a big shop, we're 2,000 people in IT alone. So we put a lot of effort into culture. And how do we make sure that we have engaged employees? How do we make sure that we have employees who feel empowered to raise their hand and say, I think there's a better way to do this? And, just so that they really have that culture of being a team. And so I would say that's the underpinnings of anything that we're successful at doing, is having 2,000 people that are working as part of one big team, and that they're all engaged. Now, some of the things that we were specifically recognized for this year included, we call it the Office of Continuous Improvement. A lot of shops have let's say a process improvement shop. We actually have two in DTMB, and we have one that's focused primarily on IT related things. So they're focused on, we have a requirement that says anytime you're going to do any big upgrade or launch any new system, first you have to do a process improvement an initiative around that process. So you're not repaving the cow path, as they say. Let's make sure we have an efficient process before we try to automate it or re-automate it. So that's something that we've really focused on. Another thing the state's done, and people might say, hey, this is kind of geeky or whatever, this is like privacy space is maybe kind of a niche thing and people don't, but the state's actually put a lot of effort into data and privacy. We require each of our agencies, which are, the state departments, kind of subunits of the state, we require them each to actually have a chief data steward. And that when we do any work in the IT space, we're giving, putting some effort into understanding the data classification. So that way, when we go out, we're not overbuying from a security perspective, but we're ensuring that we have the appropriate controls in place. And then finally, the last thing I'll say on this is we were recognized for some efforts around human-centered design, user experience, things like that. If folks that are familiar with the new Secretary of State registration system that got launched recently, or the new Department of Natural Resources system to do hunting and fishing licenses. And so those are both examples of how can you not only build an IT application that does what it's supposed to, but it's actually nice for the residents or the users to interact with. So, and that's something that we're going to continue to focus more on.
Let me ask you, since everybody's gone to virtual because of the COVID, and you guys probably have a lot of state employees working from home. It looks like you are as well. What sort of risks does that pose, though? I mean, the BYOB was the big thing a few years ago. Bring your own device and also bring all your viruses and hackers with you, kind of thing. How do you protect yourself from all that?
Yeah, certainly it's a big change. Yeah, as you say, I'm coming to you here from the Brahms basement office of DTMB, and that's where I'm guessing we still have roughly 30,000 state employees that are doing remote work right now. So let's say that's roughly 30,000 out of 50,000. So that's a big deal. That's a big deal from an IT perspective, not only from the angle of how do you empower your employees to do that? How do you give them the tools to do it? But as you said, from the security perspective. So, just to start out, as like I said, I was appointed CIO probably about a week before we had to do this. Luckily for me, as I said, I've been with the team for a long time. So I had, long relationships with all the IT deputies, and I've been very involved in this. But, so in some ways, we were really well positioned for this, both from an enabling remote work as well as enabling secure remote work, as you say. We had switched over years ago to Office 365, and when you move to a platform like that, you have decisions that you can make around how much security do you want to do. And so we had done things like we had required MFA for that. We certainly we have a privacy approach that is based on many conditions, some of which is this a state device, that's accessing this, this information. So whether it's your laptop, desktop, or whether it's a state cell phone or smart device, I should say. So those are things that we've all done. Luckily we had rolled out a lot of the endpoint protections for those so that people could work from home and they could do it in a way that we felt comfortable, that it was still secure. So certainly, we, there were other things that we had to do to ensure that it was secure. So we didn't have anywhere near enough VPN licenses or tokens, just because people that worked remotely, it was like hey, I'm going to do it this week, or I'm going to do it on a Friday or something like that. And the vast majority of state employees were not regularly working remotely, but we knew that this was something that there was a demand for. We did have some agencies with people that primarily work remote. And so we did have the capability to do that, but certainly we had to look at that and say, all right, we're going to need to at least double our VPN capacity if we're going to be able to support this so that people can securely connect. And so that was, a bit of a scramble. We knew, we want people to be working on, as I mentioned, state-owned and managed devices. We don't, as a general rule, we don't allow people to work from personal devices. Now there's, periodically you can log into Office 365, let's say, but there was a big scramble from us to make sure that we had enough laptops. Because frankly, a lot of people, if you worked in an office setting all the time, you might not have had a laptop. And so, there was that scramble. How do we get laptops? How do we get the VPN set up on all these things? How do we make sure that people know how to use VPN? Frankly, it's easy for us to get it and push it out. But it's another thing, the end user has to take some initiative there, and they have to actually set it up. And so we knew we had a really short timeline to do all this. And so a lot of it was, the tech stuff. How do we make sure that it's there? How can we push it? How can we do these things? But so much of what we did was just training. Like I said in the very beginning, it comes back to the person. We put together, in a week, we put together training videos. Here's how to set up your VPN. Here's how to do your MFA for your Office products, your Microsoft products, excuse me. We even put out advice for people. How should you manage your home network, right? That's our biggest concern is now people are working on their home networks and we don't control those. So certainly a VPN is a good step. Using MFA is a good step. But we gave state employees best practices for how you should set up your home network, things like that. I'll tell you the one real upside of sending everyone home quickly was driving adoption. We moved everyone over to Microsoft Teams like that, whereas that adoption might have taken a year otherwise to get everyone up and running. So no, we're very comfortable with where we are, and we're starting to look now at what does this mean in the future? What does this mean? What does this mean for our brick and mortar facilities? How many offices do we have? How do we potentially use expanded remote work to be able to recruit from a broader pool, et cetera?
Yeah, we got about 2 minutes left. And that was my question I was going to ask is, just like the previous guest, is this the new normal or is there going to be a hybrid model? You only got about a minute. I'm sorry, but go ahead. What do you think?
No, that's great. Yeah, that's the big question now, right? Because we're going to need to respond from an IT perspective. The state government's going to need to know how to respond from a buildings perspective. If you're asking me, again, I'm not the governor. I'm not the boss of 50,000 state employees, certainly. But if you're asking me, I think that it's going to be, for state government, I suspect that there's going to be kind of a hybrid model. I don't necessarily expect a big move to 100% remote, i.e. you don't have an office. But I certainly expect, just if you look at the trends in the industry, that if we want to continue to play in IT and we want to continue to recruit and retain people, we're going to need to offer more flexibility, and we're going to need to figure out how to build and maintain teams when we have people working remotely more often. That would be my guess on that. So that's
and I can tell you, as someone who works at a university, and now that the students are accustomed to remote learning, I think people are going to be a whole lot more comfortable with it as the years go by. So
100% agree.
Take us out, man. I'm sorry, we're out of time in this segment. Go ahead, Matt. Take us out.
Okay, well, we want to thank our guest here with us today, Bram from the Department of Technology Management and Budget at the state of Michigan. Thanks for being with us here today, and we'll be back in just a minute with another segment of the M Squared Techcast.
What do you get at Lawrence Technological
Brahma will
University?
produce an MP4
Everything.
file
Great
that we'll
lab,
send you later in the
studios,
week.
supportive
And then
professors,
share it with
technical
Haven't
support,
seen Fred yet, just so you know.
athletics, and all the
We're not
software
Okay.
you need to
That
succeed.
sounds good. Hey, I appreciate it. Happy to come back anytime. Just give us a holler.
Everything.
All right, we'll do. Thanks.
Salaries of Lawrence
thank
Tech
you.
grads are among the highest of any university in America. Plan a campus visit to meet with counselors, faculty, and coaches. Why wait? Find out more at ltu.edu.
Lawrence Technological University graduates earn a degree and a higher starting salary. In fact, when it comes to earning potential, the Brookings Institution ranks LTU 5th among U.S. colleges and universities.
Fred's probably on your other link.
Be more. At
worried
LTU,
about.
possible is everything.
Salaries of Lawrence Tech grads are among the highest of any university in America. Plan a campus visit to meet with counselors, faculty, and coaches. Why wait? Find out more at ltu.edu.
As a Lawrence Technological University graduate, you're not only marketable, you're worth more. Yes,
Good call.
more. According to payscale.com, when it comes to graduate salaries, LTU is in America's top 100. Be invaluable. Be more. At LTU, possible is everything.
Salaries of Lawrence Tech grads are among the highest of any university in America. Plan a campus visit to meet with counselors, faculty, and coaches. Why wait? Find out more at ltu.edu.
Lawrence Technological University graduates earn a degree and a higher starting salary. In fact, when it comes to earning potential, the Brookings Institution ranks LTU 5th among U.S. colleges and universities. Be enriched.
Here he is.
There he is.
At LTU, possible is
I'm
everything.
sorry, guys.
Salaries of Lawrence Tech
Oh,
grads
you have
are
the right
among the
photo.
highest of any
All right.
university
As soon
in
as we
America.
finish this
Plan a
spot,
campus
go ahead, take us
visit to
in.
meet with
Dave.
counselors, faculty, and coaches. Why wait? Find out more at ltu.edu.
Hey, it's Matt Roush.
And Mike Brennan.
And we're back with our weekly visit from our very own Dr. Doom, Fred Brown, epidemiologist and infectious disease expert. And we are just waiting to see his pretty face. He has connected with us, and I think we can hear him. Fred, you there?
I'm here, but I cannot seem to start my video. It says video failed. Let me try to, maybe I should try to re-sign in. I
Okay.
apologize.
Yeah, go right ahead.
We'll kibitz here for a few minutes. So
Perfect. Let's see what I can do.
Well, I'm gonna be real curious to ask Fred about this Pfizer vaccine. What I thought was interesting was is that they didn't take any of the so-called Operation Warp Speed money, although their German partner did take money from the German government. So I just wonder what that's going to mean for availability and distribution and all that kind of thing. I mean, this is going to be the largest logistics project in the history of the human race. You know, getting 6 billion doses of this thing out there.
well, that's assuming it's only one dose.
Well, yeah, right.
Could be multiple doses, you know.
And if the antibodies don't last very long, are we going to have to
Here he
keep
comes.
them?
Okay.
So, well, and the trial said the trial said it was 2 doses, 21 days apart.
Okay. So Fred, let's
Yes.
talk about this. Let's talk about this Pfizer vaccine. Here.
I'm really sorry. I've been doing work with transition teams all day today, so I'm sort of I didn't get much sleep all day yesterday for the news, and then
We're glad you carved out a half hour for us. We really
it's a
do
pleasure.
appreciate
No,
it
wouldn't miss it.
because I know how busy you are.
This is a
Oh.
great day, you guys. It really is a truly great. I mean, yesterday was a great day. I heard the news on the DSMB, yesterday, and wow, what a tremendous breakthrough.
Well, once you get through the show, you can treat yourself to a glass of wine, you know. So
Already had some champagne last night.
oh, okay, great. All right. Well,
So the vaccine they're saying in the trial so far, they're saying the vaccine's 90% effective. I just heard it's 2 doses taken 21 days apart. Do you suppose we're going to know, I mean, how long the antibodies, the immunity lasts, or because, we've heard some cases of some people with this thing, they don't show any antibodies after 6 months after they've had it. So that means they have to go get another shot every 6 months. I mean, what does it mean?
There are a couple things that we still don't know, that we're still trying to figure out, obviously, and we're probably going to close out the trial at the end of this month. So they'll have 164 cases by the end of this month. That's the end of the trial date closed. They may or may not allow Pfizer to continue on. It'd be better if we kept everything sealed and before we opened up and revealed everything to the sponsor company, just so we have better statistics. However, everyone's really eager to kind of see what things really look like in terms of the other endpoints, which include severity of disease, some of the durability questions you're asking, as well as transmissibility and mortality, which of course we have to wait probably two years out to really find out about. But every time you open up the trial, of course, you reduce the statistical power of that trial. Luckily, we did design this trial for power even at 32 cases. You have to get 6 cases, and then you can look at the 6 cases and every 32 infections you've got. So we should be having quite a few infections to take a look at, and hopefully they'll let us open it up at 164.
Well, certainly Wall Street was excited. Last I looked, it was up like 2,000 points or something, So people are making money today in New York.
Well, I'll tell you, I had my doubts, and we all did in the community about Operation Warp Speed. We were doing a lot of things that kind of violated traditional rules and about what's normally done in clinical trials. My guess is we saved probably close to about 200 days in research, basic research, and we probably saved about 3 years in clinical development, and that's about that's almost 4 years of excess deaths at 400,000 a year projected, right? So that's 1.6 million people. If Wall Street wants to make some money on that, more power to them, because we saved a lot of lives if we really pulled this thing off. We're not 100% sure yet, but if we pull this off, it is a remark. It's actually kind of a dawn of a new age in medicine. It's a dawn of synthetic vaccines, a dawn of being able to, predictably inject new proteins, new protein machinery into your cells, which could solve all sorts of additional disease states, including, cystic fibrosis, among many others.
Wow.
Yeah, I mean, it really is remarkable. The mRNA is going this way. Basically, what we've done is we've overtaken the way bacteria infect us, and we've put that into our capabilities now. Almost predictably, which is remarkable.
So the other big question I wanted to ask you, obviously with Saturday's call of the election, barring a Hail Mary from some lawsuit, and Hail Marys only work against the Detroit Lions, right? So it's looking pretty safe. So I mean, assuming there is a Biden administration, what do you think is going to change in the management of this pandemic come January 20th?
Well, gosh, if we have the 90% effective vaccine with a backstop, the heavy lifting's been done, frankly. I mean, that is just a huge change in our capability, huge change in our policy capabilities. It means that, we sort of have a light at the end of the tunnel, if you think about it. So before, we didn't know how long this period of partial vaccine was going to be, and how much how partial the vaccine would be, and how long that period would last. Now that we have potentially a backstop, and it becomes much more a controllable, maybe even preventable vaccination-based disease, that means that we could potentially do a lot more in the short term to shore up people, knowing that we only have a certain amount of time remaining, right? All of a sudden, your whole philosophy, but gosh, how much more stimulus do we have to put into the economy? How much more are we going to have to hold off with PPE and continue manufacturing? How much more are we going to have to expand our capabilities for surge capacity in healthcare? All those things pull money away from the more productive parts of the economy. And so, on the economic front, we're talking about a much faster route to recovery than I was projecting. I thought it would be early as 2023, mid 2023. It may be a year earlier than that for full economic recovery. And our vaccination, by vaccinating this many people, we may hit herd immunity already by mid 2022. Now, there's a big if there, and that is, believe it or not, even with 90% effectiveness of a vaccine, if only right now 30% of people are going to take that vaccine, and with the potential of 20% more joining the people who are questioning whether the vaccine is going to be safe and effective. If you do all the math, that's only 45% control, right? 50% times 90%, 45% control. So now the communication has to be, trust the science, look at the results. And I I did put a couple of things together, actually. If you're interested, I could show them quickly.
Sure,
Or we can just talk about the day. But there's a couple of things that might be helpful to share. And let me see if I can pull something up here that might be interesting for you guys to look at. This one, I think. Well, so can you see my screen all right?
Now we can.
Perfect. So here's sort of the way it looks like it may roll out. And I just need to get to a slideshow here. So it looks like we're going to have first dose in man, on an EUA basis, probably around January 1st, maybe even a week or two earlier than this, which means you get the second dose 21 days later. So, you're into the first group of, say, by the end of February, the first 20 million people will be injected in a series that's going to go from basically January until probably about mid-March. Now, if you think about it, you have to have a second dose 21 days later, and then you get immunogenicity. Actually, that was faster than I thought too. Immunogenicity actually occurs 7 days after the second dose. So all of a sudden, you're looking at kind of a mid to late March initial impact of the vaccine. Now, it's only 20 million people, so that's less than 5%, less than 6% of the population. So we've got a long way to go in terms of vaccination. What's interesting is that Johnson & Johnson comes through probably with a vaccine that's vector-based. Now, we don't know anything about how safe and effective the vector is yet. We do know that it was shut down. They shut it down themselves. It wasn't shut down by the FDA. It was not put on what they call clinical hold. It was just paused, what they call paused, a clinical pause by the sponsor, which is J&J, due to safety reasons. They seem to overcome those, as well as AstraZeneca. Now, the important thing about AstraZeneca and J&J is that they have a lot more capacity than Pfizer does, a lot more. And if you only have to have one dose before you get immunogenicity, you miss that 21 day plus the 7 days. So you're missing a whole month. You're getting to immunogenicity a month faster. Plus, they don't have the cold chain requirements that Pfizer does, which is a -70. So you can see that we're projecting 200,000 cases a day, kind of around January 12th, 15th. I think it's going to probably peak. But I mean, that's a lot of cases to start from, right? And so we still have a long haul this fall, but then we're going to start to see probably, as I said, as this chart shows, by October, November, maybe 120 million people, with some immunogenicity from the vaccine, and that will actually slow the vaccine down. And so we could drop, for next fall this time, we could be, well, even below 100,000 cases a day, even despite the peaking that we're having already, and the Thanksgiving and Christmas threats that we'll face next year at this time. So we could literally have the number of issues that we're having right now with COVID by this time next year. And certainly, hopefully by Easter next year, we're talking about getting to a point where normalcy, at least social normalcy, economic normalcy, is likely to be back. Maybe not complete health normalcy, because again, it depends so much on how many people take this vaccine.
Which brings me to my question is,
Yes.
is it going to be the frontline workers get it first and then the senior citizens get it next, or how are they going to play that out?
That is a great question. So, and believe it or not, the answer to this changed because of the level of efficacy we're seeing. We have checked safety, but originally, this is the wrong chart. Anyway, the blue dot should say 6%. So 6% of the vaccines will be generated by, it should say April. I should have this. I have this on a different slide. I apologize. By April, 6% of the population will be vaccinated. By September, approximately 33% of the population will be vaccinated. Then we'll have about 27% of the population done between kind of the 15th of September through the 1st of January, and then everyone else like myself, who are between 18 and 64, that's 42% of the population, will probably be vaccinated after next Thanksgiving. That's the way it's going to roll out. Now, the reason that the number changes between now and before we knew what the efficacy was is because the better the efficacy is, the more you actually want to protect your most vulnerable. So in the past, we thought the efficacy was only been 60 to 70%. If you do all the math, it turns out that when you have 60 to 70%, the right people to inject are the ones who are most likely to transmit, and those are and get sick. Those are the frontline healthcare workers, which is why the original NAM, the National Association of Medicine recommendations, were for going after healthcare workers because we thought they'd be transmitting. Now that we know that efficacy may be as high as 90%, and that and especially Moderna vaccine will be safe for elderly, they actually have a larger elderly population in their population than Pfizer did on a percent basis. Now that we know something more about that, it's very likely that we'll actually be vaccinating a lot more of those who are over 65 and have at least one morbid condition that is likely to have a bad outcome if they were to contract COVID. Because we want to try to save as many of those very at-risk people as possible because it's so effective. Anyway, that's how the way the math works. And so this chart is now wrong because we will now change all of our numbers based on a new efficacy number. So I did change all those numbers for you, and I sadly opened the wrong file. So, the numbers I read off, 6% moving to 25%, moving to another 27%, and then the 42% at the end is correct. And the timing is earlier now. That 6% will be done April 1st. The 25% additionally would be the phase green. Phase 2 will be done around September. Phase gray will be done around Thanksgiving of next year, and then the rest of us will all get our vaccines probably late 2022. I'm sorry, late 2021 to early 2022. So that's that.
So but there's multiple vaccines that'll be out there. It won't just be the Pfizer. It'll be what?
Yes,
a lot of them, right?
Yeah. So basically, we've probably, well, now, we shouldn't get too excited, and I'm a technologist, so I love this stuff. But I think Moderna is likely to come through 2 weeks after Pfizer. That's about how much they're delayed. They have another. I'll show you quickly who's all coming out here. Here's what's coming out. Here you got Pfizer. You can see that they've got the ability to make slightly more than 1 billion doses, about 1.2 billion doses a year right now. Now they're going to escalate from that. Moderna has about the ability to make 1 billion doses a year. Those both use the same technology. That's the mRNA technology, as you know. And the problem with these vaccines is that they are very difficult to ship and scale. So basically, Moderna and Pfizer solutions are basically an OECD or organization. These are for advanced countries who can actually transport and succeed in a -70-degree environment. What's interesting is you see that the scale of AstraZeneca. AstraZeneca has a capability to do 6 billion doses a year.
Wow.
The vector-based vaccine, they're gonna be able to close out their studies by the end of the year. Now, the vector-based vaccines have a much more challenging safety profile in some ways than Moderna and Pfizer. Now that we know that they're so efficacious, but they, traditionally these vector-based vaccines are quite a bit more efficacious because they're much more likely to stimulate the T cells. The T cells are much better for durability and for the T cells actually neutralize have a much better neutralizing capability. So you can see AstraZeneca, J&J, and Russia and Merck are all coming through with vector-based vaccines. The reason that Merck's is so interesting is they've got a capacity of almost 3 billion vaccines a year, and it's an intranasal spray. So we may actually see some improved efficacy and a much better transportability than an intramuscular vaccine. And then you see Novavax and Sanofi. They'll be opening up their Novavax said early 2021. Now these you can see that they're working with Takeda, so they've got about a 2 billion vaccine capacity, and they could also add to the mix, and that'll be a different kind of profile vaccine. The way we look at vaccines is basically along these four parameters, right? You look at safety, you look at effectiveness, you look at scalability, and look at durability. So we were looking at scalability. How easy is it to get big? And the answer is, if you already have existing manufacturing capacity of 6 billion doses like AstraZeneca does, if it comes through, it's a huge impact. If it fails, it's also a huge impact because it means we're not going to get to our 13 billion doses. It's almost half the worldwide capacity we're looking at. We have to wait for an Indian producer to come through for us at that level of vaccine capability. But if you look at safety, here are some of the things so we haven't opened we don't know the answer yet. I mean, there's only 13 people in the world that actually know the answers. That's the review board that looked at this and opened up the data sets. So when this data becomes open, there's some questions you should ask yourself about which vaccine is going to be the best for you, right? The first question is about safety, because you don't want to take something that's going to get put you over the hump in terms of an adverse event that could be worse than the disease itself. And so you want to look at the absolute level of serious adverse events. And they rank serious adverse events on a scale of 1 to 5 based on whether or not you've had to go to the doctor, how bad the adverse event is. If you have to go see a doctor, you're at a 4 or 5. Most of the adverse events that have come through are 3 or less, but they are significant, especially after that second dose for Pfizer. You really get shakes, chills, fevers. It's 1 or 2 days of being out. And if we have to do this every 6 months, as Matt said, or every year because it's not terribly durable, people are going to start to say, God, I don't know if I want to go through that again. But basically that's going to be your ticket to go see grandmother. It's going to be your ticket to go on the air flights. It's going to be your ticket to go on cruise ships. It's going to be valuable. So maybe every 6 months is okay. It's also going to be, reasonably expensive, $20 a shot, which for some people, starts to add up if you're doing it quite often. The next question is, how inclusive was the trial, right? So how impactful was the inclusion-exclusion criteria of the trial? Did they start to exclude people who weren't like you? Do they start to exclude certain populations who were elderly, had special conditions? And you'll see that there weren't any people who were tested, for example, who were under the age of 12. No one's been tested yet who is getting dialysis. No one's been tested yet for people who are immunocompromised and on those kinds of cancer chemotherapy treatments. No pregnant females have been injected, or people who are thinking about getting pregnant. So those people have been excluded. So if you're in that group, you want to say, maybe this one isn't. I'll wait. I'll wait till I get it right. And then if you got broad demographic eligibility, here the question is the region of the country, which vaccine strains you're looking at, and so on, right? And then you want to make sure that they have low thresholds and types of adverse events they were actually tracking and looking and put into their statistical tables, or something that is meaningful for you. And then how long did they have the safety data? Now, we will have 2 months safety data. In other words, half of the population who's been injected will have gone through at least 2 months of looking and observing. These people who are on these trials actually have a phone, and they report in how they're feeling every couple of days on their what they call patient-reported outcome system. If you have an adverse event or not feeling good, you report it immediately, because that's especially important, because if you come down with a symptom of COVID, they want to know that and put you into the study of saying, hey, we may be able to prove efficacy here if you weren't injected with the real vaccine. So what's interesting about the duration of safety is normally, for this kinds of vaccines, we would probably take a year to 2 years of looking at safety before we made it broadly available to everybody. So welcome. In this case, we'll only have 2 months. Now, usually most safety profile problems come in after 42 days. So that's a good thing. We'll have 60 days. But the WHO wants 90 days. So most of the rest of the world will wait until they have 90 days of safety data before they take this vaccine. We'll do it after 60. So you may want to wait a little while longer, make sure the safety data is coming through, and because we're only looking at 164 patients so far who are who are actually testing positive at the end of the trial. Then effectiveness. You want to take a look at the effectiveness question. And one of the questions is, did it reduce the severity and the duration of the symptoms? So how severe your symptoms were, if we're able to get those down, we can actually reduce hospitalizations. And that's significant, because right now, 10 of our states have more hospitalizations than they've had ever. before today than ever before so far in the 9 months we've had this disease. We got 10 million active cases right now. That's a lot to work with. And if all those people start going to the hospital because you didn't reduce severity, that's going to be an issue, and it could overwhelm the health system and cause huge amounts of excess death, as we know. So that endpoint, that what they call clinical endpoint, is really critical. The reduction of transmission is even more important, because if you're able to reduce transmission of the virus, you actually have a logarithmic impact on the transmission of the disease and the expansion of the disease. If you don't do that and all you do is reduce the symptomology, then you still have the same transmission. You still can start to get to those very vulnerable populations pretty easily. So that's going to be important. And then of course the baseline and the thresholds in the trial are really going to be important. So those are the safety efficacy pieces that we'll start to get to know quite a bit by the end of this month. Scalability. Don't forget this drug will only be available at the Pfizer vaccine will only be available to portions of the U.S. because of the cold chain. They only have 1 billion doses a year manufactured. We need 13 billion on a global basis. We'll only have the first 100 million doses for free. After that, it's going to become charged. It'll be charged as much as we contracted for. And we want, the booster shot is going to be a significant question, how durable this is, and whether we need to, because if you think about it, if you need a booster, it means you've halved your capacity, right? So when J&J comes by and says we've got an ability to make 1 billion doses, that's 1 billion vaccinations that are done. When Moderna says that, it's only 500 million doses that are done. So that booster shot really makes a big impact. And then of course the durability. Do you have persistent high titer levels of neutralizing antibodies? We'll start to know that over the course of a year or two. That's going to take. These studies continue on and have review points at day 365 and day 700 and 20, whatever it is, 1 year and 2 year basis after you've taken the vaccine. We'll have those data at that point. And one of the questions that people bring up, some people have allergic reactions to adjuvants. A number of these, like Moderna, like Pfizer, those vaccines do require adjuvants. So if you have allergic reaction to some of the mercuric and other adjuvants they put in, then you might want to watch that as well. So that's some of the things to think about when you see the clinical trial results when they start to come out at the end of the month. You'll see Pfizer's full results. You'll see Moderna by the end of this month. See Pfizer's full results. You'll see Moderna's interim results. You will see in January AstraZeneca's interim results, J&J's interim results by the end of January, and then you'll start to see Novavax and Sanofi and Merck's interim results in March, April. That's a lot of vaccines coming through the pipeline.
Okay, we got
but
about
in the meantime,
left.
in the meantime, we dare not let down our guard, though, right? In terms of social distancing.
Please,
and all that
yeah,
stuff.
it's a great reason to celebrate, but we won't have this will not be an impact that's felt this year. It'll be an impact that's felt, as I said, probably starting this time next year. So we're celebrating now, but be careful all the way through this time next year at least, with NPI, with continued distancing, with hygiene and hand washing. Those are really what we have to offer at this point. And the vaccine's coming, which is great news.
All right. Well, we got about a minute left. So, Fred, how do people reach out to you if they want to get more information? Oh, and you alluded to being on a transition team. There's only one transition I'm aware of. So does that mean you're going to be working with the Biden administration?
Well, I don't put myself in any particular administration. I've been trying to help out every administration, but I am trying to help a number of governments who are trying to transition right now at the state and national level. And yes, to the extent that I can help the U.S. nationally, I'd love to do it. Frankly, some of our states are going to have bigger challenges than the national government, just because they're going to be responsible for ultimately deciding who gets the vaccine in their states. The national government will say, here are your vaccines, and the states will have to actually distribute. And those systems and those capabilities are challenged in a lot of states.
Okay. Take us out, Matt.
All right. Well, we want to thank Fred Brown, our epidemiology expert, and all of our guests today. We started off the show with Enrico Schaefer, and we also had with us, oh gosh, I'm blanking on his name. Mike, help
Bram
me out here.
Stibbets.
Yes, he's the CIO of the Michigan State government, and a very good guest and a very interesting segment about how they made the shift to virtual workplaces. So we'll be back next Monday at 2 p.m. Eastern Time. Until then, it's Matt Roush.
And Mike Brennan.
And you've been listening to the M Squared Techcast.
Thanks, Fred.
I'm sorry about that. I had connectivity trouble. I don't know what happened. At first I didn't get anything, and then I got just sound, and then I.